But what if I told you that some of those tests, the ones your doctor says you need, could actually be pushing you closer to unnecessary surgery, a stroke, or even cancer? This isn't just my opinion. New studies show that up to 37% of medical tests for seniors lead to unnecessary treatments, complications, or lifelong side effects. And here's the most terrifying part. 99% of people over 70 have no idea they're being over-tested. And one of the most common tests we'll talk about today actually causes a percentage of all cancer cases in the United States, a number that's on par with daily alcohol consumption. You won't hear this from your clinic. You won't see it on a billboard. The truth is buried in the science, and today we're going to uncover it all. This video is for anyone over 70 and for anyone who cares for them. We're breaking down the 5 health checkups you should reconsider and the real risks they pose to your body. All of this is backed by genuine research, and you won't believe what made it to number 2 on our list. Before we begin, tell us in the comments below, have you ever regretted a medical test or procedure? Do you think seniors are tested too much? We're reading and replying to every single comment with personalized tips. Don't forget to like this video and subscribe. 5. The bone density scan. Let's start with number 5, the bone density scan. It seems harmless, right? A quick scan, no pain, and you walk out with peace of mind. But here's the uncomfortable truth. Past the age of 70, this scan can often create more fear than it provides benefit. Officially called a DEXA scan, it measures bone strength to detect osteoporosis. But for older adults, especially women, the results almost always come back showing lower density. Why? Because bone loss is as natural as getting gray hair. And yet many seniors are immediately pushed into medications like biphosphonates, which are supposed to strengthen bones, but come with serious side effects like jaw pain and esophageal irritation. Worse, studies show that treating mild bone loss in people over 70 has almost no impact on actual fracture rates. You're more likely to get the side effects than the benefits. Take Rose, a 76-year-old retired piano teacher. She was active, healthy, and had never fallen. Her doctor sent her for a DEXA scan anyway. The result? Mild osteopenia. Her doctor immediately put her on a medication. 3 months in, she had severe jaw pain and couldn't play piano. The cure became worse than the potential problem. We helped her transition to a regimen of vitamin D, weight-bearing exercises, and a nutrient-rich diet. A year later, she was back to playing Chopin with stronger legs, better balance, and no fractures. Don't let a number on a screen scare you into treatment you may not need. 4. The brain MRI for memory loss. Now for a scan that can lead to something even scarier, brain surgery. Number 4, the brain MRI for memory loss. When seniors feel a little more forgetful, the fear of dementia is immediate and overwhelming, so doctors often order a brain MRI. Here's the problem. Most MRIs in people over 70 simply show age-related changes. The brain shrinks slightly and tiny white matter spots appear. This is normal. But once those spots are seen, they can trigger a cascade of fear and more invasive tests, even surgery. A 2021 study found that of thousands of MRIs done for mild memory issues, 97% showed abnormalities that were not linked to a treatable condition. Imagine the emotional toll of hearing there's something wrong when there really isn't. I saw this with George, a 74-year-old retired engineer who was worried about misplacing his keys. His MRI showed white matter changes, and he was convinced he had dementia. He stopped driving and became a prisoner in his own home. When we did a proper cognitive test, his score was normal. We explained the MRI findings were age-appropriate and helped him focus on sleep, hydration, and brain games. Within months, his memory had stabilized, and he felt like himself again. A simple cognitive test is often a better first step, saving you from a roller coaster of fear and unnecessary procedures. 3. The cardiac stress test. Brace yourself because the next test on this list is one you've probably had multiple times. Number 3, the cardiac stress test. It's a common test for seniors complaining of mild fatigue or chest tightness. But after 70, this test often does more harm than good, especially for people with no clear signs of heart disease. The false positive rate for stress tests in people over 70 can be as high as 40%. That means it says there's a problem when there isn't, leading to follow-up procedures like angiograms and even unnecessary stent placements. A major study in JAMA Cardiology found that more than half of all stents placed after stress test referrals were in patients who got no benefit from them. Raymond was a 75-year-old retired postman. He was active, but sometimes felt tired on hills. His doctor ordered a stress test, just to be sure. The results were unclear, so he was sent for a catheterization. A mild narrowing was found, and a stent was placed. But Raymond had a reaction to the contrast dye and ended up in the hospital for 6 days. The fatigue never changed because it wasn't a heart problem to begin with. It was simply an older man who needed better hydration. A resting EKG or a calcium scan are often safer, simpler options. 2. The colonoscopy. You probably didn't expect this one. Number 2, the colonoscopy. It's not always a wise choice after age 70 and is almost never recommended after age 75 unless you have specific symptoms. The risks go up with age. The prep is harsh, the sedation poses risks to your brain, and the procedure itself can cause complications like bleeding or tearing. A 2019 study over 1.3 million Medicare patients over 70 found that for every 1,000 colonoscopies done on those over 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Dana was a 73-year-old grandmother with no symptoms or family history of colon cancer. Her new doctor urged her to get a screening. She agreed. During the procedure, a small polyp was removed. But that night, she experienced intense abdominal pain and fainted. At the hospital, they found a bowel perforation. She spent 9 days recovering and has never been the same. If you have no symptoms, a safer, at-home stool test like the FIT test is often a better option. 1. The annual full-body CT scan. And now we've reached the most overused, dangerous, and harmful checkup for seniors. Number 1, the annual full-body CT scan. Marketed as a way to catch cancer early, these scans expose you to a high dose of ionizing radiation, the equivalent of around 500 chest X-rays. Here's the shocking truth. There is zero evidence that full-body scans without symptoms save lives. In fact, a 2023 study found that the rise in CT scans may now be responsible for up to 5% of all cancers in the U.S., putting them on par with alcohol as a cancer-causing factor. That means 1 in every 5 cancers could be caused by a scan that was supposed to prevent it. Take Marcus, an active 80-year-old. His full-body scan showed a tiny nodule that set off a chain reaction of tests, including a biopsy. The result was benign, but the biopsy collapsed part of his lung, leading to a 2-month recovery, all for something that could have been left alone. Experts are clear. Full-body CT scans should never be used for general screening in asymptomatic adults. If you feel well, listen to your body. Your health is too valuable to risk on fear-driven screening that could leave you worse than where you started. So there you have it. 5 checkups that may seem helpful but can actually hurt, especially once you're past 70. Sometimes less is more. Always ask your doctor, what happens next if this test finds something? If the answer is unclear, it may be time to pause. Real prevention starts with lifestyle. Stay active, eat well, sleep deeply, and choose your checkups wisely. Have you or someone you love ever faced complications from a medical test? Share with us your experiences in the comments below. We'd love to hear them. Thanks for watching.